Dr. Wise, what questions should patients ask their healthcare team about testing and test results?
It's a great question. I think patients first of all should really understand that although the oncologist often has a lot of information and often a lot of experience, the patient is the one that really should have the power to make the decisions. And the patient should often remind the oncologist of that shared decision-making is a crucial empowerment concept that patients need to understand. Patients come into a treatment in an incredibly vulnerable position, and that's for a few different factors. And I think that they need to understand that that they need to express their preferences, and they need to actively take part in that decision. And I think expressing that is really important. I think oncologists should also help patients understand that it's really that they're the ones in the driver's seat, that they're the ones that are making they have the power to make the decision, and that the decision should be arrived at in a shared decision framework. In terms of questions patients should ask, patients should always ask about alternatives. I think oftentimes you hear maybe just about one treatment option that the oncologist thinks might be the best, but I think it's important to constantly say, well, what are the alternatives here? Is there anything else that we could think about? Perhaps that treatment that you're suggesting sounds really exciting, but it really may not work for me, for my particular context. And so is there another option that the oncologist may not be thinking about because it wouldn't be their usual recommendation, but maybe in my specific circumstance, there might be something that would work better for me? I think those are the kinds of questions, continuing to voice, your preferences, what you want, that finding the right treatment is so critical, and arriving at it from a shared decision making, it just continues to build sort of that relationship, and it makes for a much better dynamic over the course of that treatment and others.